Hello everybody, my name is Robert Chmielewski. I'm from Poland, not Holland. It is very good as they change Holland to Netherlands back to normal name. I say no one now disappointed. Poland, Holland, you know, it's pronounced very simple. Thank you for a very nice lecture, but why you don't show a cannulas? The best cannulas ever in the world of TSK and absolutely unique. Sorry, it's product placement for you. Extra. Future of bioregeneration. Why is future and what is new? Actually, we think that we know a lot about bioregeneration and really I think what to say how to surprise you about bioregeneration. Resteeme, and why Resteeme? Resteeme your skin, respect about skin physiology, respect about biology in general, because sometimes we can meet bioregeneration, but it's not bioregeneration. It is pathological regeneration, sometimes with some pro-inflammatory. And a new line of bioregeneration, Resteeme, create in philosophy, in Resteeme to the skin philosophy. Why? Let's take a look what's happened in the start when aging, inflammation, chronic inflammatory, when it starts. I remember in the past say that sugar, it is a white death. Yeah? When sugar binds with proteins, with lipids, start pathological process, what we named glycation. In glycation, finally, in Maillard reaction, starting to create ages. It is not ages. Yes, ages speed up age. It's advanced glycation end products. What is it? It is actually when sugar bind with proteins and lipids creates ages, advanced glycation end products, and these stimulate and speed up aging, stimulate oxidative stress, and stimulate chronic inflammation. How it works? It works very simple because, as you know, and dermatologists know what is NF-κB. Nuclear factor kappa B. Nuclear factor kappa B, it is the most important factor in self-healing and self-tissue regulation of chronic inflammation and oxidative stress. As you know, our tissue can control some pathological processes. And nuclear factor kappa B play main role in this self-healing, self-regulation process. Ages stimulate NF-κB in excessive way, and NF-κB lost their power of control of chronic inflammation and start to aging. Even today and in all conferences, we spoke a lot about collagen, about elastin, about extracellular matrix. Yes, it is very important. But we forgot a little bit about extracellular space, about glycosaminoglycan jelly, where hyaluronic acid plays most important role. What's happened when some external factor, UV radiation or some patient behaviors or even some diseases destroy tissue health and speed up glycation. Then we see the reaction that glycation end products stimulate nuclear kappa factor B and increase hyperactivate metalloproteinase, decrease hyaluronic acid synthesis by fibroblasts, and starting speed up aging, increase oxidative stress, and starting to destroy extracellular matrix, destroy collagen, destroy elastin, because in healthy skin we have very nice scaffolding of collagen and elastin. In aging skin, collagen is destroyed, and what is most important, as you see, if we compare the fibroblasts lost a power of their most important function, regeneration and reconstruction of all extracellular matrix ingredients. Because fibroblasts, they produce collagen, elastin, they also produce growth factors and cytokines. Fibroblasts manage life of extracellular matrix cell and in general of all other cells in a skin, but in also other tissues. When fibroblasts are in good condition, when extracellular space is in good condition, then fibroblasts have a power to control all pathological processes. But high oxidative stress, chronic inflammation leads that fibroblasts start to be weak. They don't have a power to produce normal physiological collagen and produce physiological scaffolding. They start to produce post-inflammatory collagen or fibrotic collagen, we can say. What is therapeutical goal? What we have to do to restore extracellular space? First of all, we have to restore condition of extracellular space of glycosaminoglycan jelly. Decrease inflammation, decrease oxidative stress. How to do it? About hyaluronic acid, we know a lot. But also, hyaluronic acid can help us to control inflammation, but even and also hyaluronic acid depends on molecular weight, control different points of all sequence of physiological regeneration, from promotion of expression of pro-inflammatory cytokines, which is crucial to start regeneration. Low molecular weight hyaluronic acid also promote neoangiogenesis to deliver more oxygen to aging tissue. Low molecular weight hyaluronic acid also promotes cell migration to help migrate the cells, macrophages, fibroblasts, to the place where place need to reconstruct. But we don't like excessive inflammation, which is induced by pro-inflammatory cytokines. And then tissue hyaluronidase cut hyaluronic acid in longer chains, in high molecular weight hyaluronic acid, to starting to control this process and decrease inflammation, decrease oxidative stress, increase hydration, and also create a mechanical support of extracellular space. Why extracellular space also is so important? Because good condition of extracellular space, it is space, most important space and way for tissue fluid flow and exchange metabolic trashes between extracellular matrix and vessels, and also deliver new materials to tissue reconstruction. And also depends on molecular weight, hyaluronic acid. The same receptors, hyaluronic acid receptors, depends on molecular weight of hyaluronic acid, which bind to the cells. They act in different way. And then fibroblast, it's managed action of fibroblast. Or fibroblast release pro-inflammatory cytokines, or fibroblast produce collagen, elastin, or even release anti-inflammatory cytokines, or even fibroblasts changed from fibroblast to myofibroblast, depends on stage of the regeneration. It is very smart, because even physiologically hyaluronic acid longevity in tissues is 24-48 hours. It means that when hyaluronidase cut some molecular weight hyaluronic acid, it's act in time as physiologically regeneration is needed, then in physiological way is changed in another molecular way. This is self-healing and self-control. What is a trehalose? Trehalose is beet sugar, and now it's a little bit tricky. We say that sugar binds with proteins and destroys proteins, and now we say that two molecules of glucose is most powerful antioxidant and anti-glycation agent. It's again, biology is very smart, and our body is very smart. We don't need some sophisticated structures or something. We use very simple way to find good solution for regeneration. And what happened when we add trehalose, which is very strong inhibitor of the glycation, reduce of oxidative stress, even control function of the fibroblast. But what is also very important, that trehalose stimulate autophagy. Autophagy, it is very important part in tissue regeneration when we need cleaned up extracellular space. And when we combine trehalose with high molecular weight hyaluronic acid, they empowered each other. Trehalose stabilize hyaluronic acid against excessive action of tissue hyaluronidase, stimulate autophagy, mitigate oxidative stress and inflammation, and what's most important, it restore regulation function of NF-κB, nuclear factor kappa B, and mitigate and control advanced glycation and products. Finally, restore metabolic balance. And as you see, different molecular weights from low molecular weights 200 to 400 kilodaltons, mid-high from 8 to 1.2, and high from 1.2 and 2.6 molecular weight hyaluronic acid, give us full spectrum molecular weights needed for physiological reconstruction and regeneration in pro-physiological way, helps for fibroblast and stimulate fibroblast in pro-physiological way reconstruction of aging extracellular matrix. So, finally, two products of Resteeme. Resteeme of skin physiology in pro-natural regeneration and bioregeneration from prevention, because you know that prophylaxis is very important. In aging patient, mature patient, regeneration where we need to restore metabolic balance, but also reconstruction. We mitigate chronic inflammation, and also, I forgot to say, that glycation, it's also induce a lot of dermatological diseases, lot of dermatosis, even mitigate of glycation, control acne and rosacea. It's help us to treat these very complicated dermatological diseases. Best combination and bestseller patented combination of few different ranges of molecular weight, not one or two molecular weights as in competitors, but Resteeme contains two different molecular weight ranges, from low 200 to 400 and mid-high from 1.2 and 1.5 million Daltons, plus trehalose. Is combining with trehalose is patented combination. How it works? As we say that combination of high molecular weight hyaluronic acid, different molecular weight ranges, plus trehalose is most powerful mitigator of glycation. In the same way, control chronic inflammation, control oxidative stress, and restore metabolic balance in extracellular matrix and extracellular space. How we can inject it? Special for Resteeme, we create new injection technique. RTDI, it is a retrograde, retrotracing diagonal injection, or even real-time dynamic injection. Because in real time, we fractionate the skin with very thin linear diagonal injection, and immediately we restore skin thickness, but in the same time, we treat all skin layers. In opposite of microdeposit or boluses or linear boluses, which finally create a trauma of skin, is damage the skin. RTDI, not damage to skin, it is the same method as fractional laser. We create only very thin, destroy tunnels, but lot of not destroy skin, stimulate physiological regeneration and restoration of all tissue layers. This is most important. And here on the slide, you didn't see the thin lines here. Is it visible or not? Yeah? This is skin tension lines or wrinkle lines. In surgery, we named is that Langer lines. Why? Because these lines is a fascia, is intradermal fascia. And when we inject product regarding these lines, we stretchen the skin. We immediately restore mechanical turgor of the skin, but in a time product diffuse horizontally in the skin regarding tissue and cells migration vectors, which are Blaschko lines. Blaschko lines, it is a cell and tissue flow migration and tissue flow vectors in the skin. Because when we do face massage, where we massaged? Laterally. Blaschko lines and Langer lines. There are 3 dermatomes from embryology. Lower face, mid face, and upper face. It is not lymphatic vessels way, No, it is interstitial way. It is why it's so important to control chronic inflammation and avoid excessive collagenous stimulation and control against fibrotic collagen. Because when we create excessive fibrotic tissue, we blocked natural tissue fluid flow in interstitial space. And it is why extracellular space, in condition of extracellular space, it is very important for health and as a tissue condition. How to do it? It is very simple. Needles, 4 millimeters, 32 gauge. Of course, the best needles will be TSK in this case. Yeah, because 4 millimeters needle is not cross along all in subcutaneous. We inject only in the skin, 20 degrees, and we not leave boluses. We leave only lines retrograde. Then we thicken the skin and create immediately, we contour the face, but in time, when product diffused, we see next day, second day, immediately and visible skin refreshing, radiance, and restore physiological skin function. Even on forehead, this technique is a very good technique to fix very deep wrinkles, because we restore immediately skin layering and control, restore and fixed deep tissue wrinkles and folds. Resteeme L, it is a second product which contains very high molecular weight hyaluronic acid, non-cross-linked, in molecular weight range 1.8 to 2.6. It's another very high molecular weight hyaluronic acid range which help us to control oxidative stress and control chronic inflammation in a time. Because Resteeme even act in the skin for longer time than mid-high hyaluronic acid. And when we combine Resteeme L, X, and L, we control in immediately and long-lasting, we mitigate glycation and control oxidative stress. Special for Resteeme L, we create another injection technique, Resteeme points. Their points, when we compare now Blaschko and Langer lines, then we understand that R5 will diffuse in temple and forehead. R1, 2, 3, 4 will diffuse in all mid-face. R8 will diffuse in marionette lines. R6 will diffuse in mandibular angle area, and crucial for face aging periauricular line will R6. Intradermal linear injection, syringe by Resteeme X is 2 milliliters. And in this case, for all each points, for 0.1, except temple and marionette line, where we inject 0.2. Intradermal. Resteeme H, it is for hydration. It's for prophylaxis. It contains molecular weight mid-high, most physiological molecular weight range, which implement immediately into extracellular space in extracellular glucosaminoglican gel. And hydrate, restore hydration, restore condition of extracellular space. And for Resteeme H also, micro injection, micro deposit technique. Resteeme H we can inject and superficial and in mid-dermis and in deep dermis. Even micro deposits will be visible about 24 hours. Again, regarding longer lines to stretchen intradermal fascia. Skin and décolleté, the same technique. Also, longer lines, they are décolleté and neck wrinkle lines. It's why we have to focus on these lines, not in regular way. It is why we inject regarding the lines. The results before and after 3 treatments, Resteeme L. It is not cross-linked hyaluronic acid. As we see, visible improvement of skin quality, hyperpigmentation decrease, and most important is that skin imperfection and inflammation signs will decrease in this phase. Second one, aging phase without cross-linked products. Restore the lifting, because lifting effect with Resteeme we achieve regarding restoration of skin turgor. The skin elasticity increase and face lift up naturally. 3 treatments with Resteeme X, also infraorbital area, nasolabial folds, and also skin oval increase. It's very, very nice. Hyperpigmentations and skin aging signs. This is a very big challenge. This is no laser, no peelings, only injection Resteeme X. Mitigation of glycation, decreasing of chronic inflammation and oxidative stress leads skin healing and restore metabolic bundles in the skin. And please imagine what's happened with this guy if we combine it with smart DNA, with Reti booster, with lasers. The result will be amazing. Hyperpigmentations also, especially in infraorbital area with Resteeme L. I know that all companies shows that something like this, but this is true. I tested on my face, on my skin, and I know when you try Resteeme, you will see next day that your skin start to be more smooth, more radiance. Like I said, it looks like covered by silicone. And summarized, special formulation and special technology of combination, different molecular weight ranges, not only weights, but ranges with trehalose or even high molecular weight hyaluronic acid ranges, mitigate glycation, mitigate chronic inflammation, restore metabolic balance, and mitigate inflammation. Resteeme create metabolic balance of the skin and other tissues before other collagen stimulation. Before you start to stimulate, you have to restore condition of the skin, you have to restore power of fibroblast, then you can stimulate. Never start from stimulation, aging skin, and weak fibroblasts. It is the same when we are very tired and we have no power, we are hungry, angry, and someone say, "Doctor, please come." We have no power. We have to be rest in good condition, in good power, then we can help our patients. It's the same with fibroblasts. Thank you so much This is my Instagram. I don't know who is guy. It is my Instagram. If you like, please follow me. And thank you so much.